Good morning, ladies and gentlemen. It is a great, immense pleasure to be here today with a doctor, and he is actually a heart surgeon. We are right here, we are at Sharda Hospital. It's one of the top medical facilities in Delhi NCR and very affordable too. We're going to ask doctor a couple of questions, very informative for you who are watching right now. And we believe that this is going to help you in making up your minds for your medical journey. Good morning to you, doctor.
Good morning.
I hope you're doing great.
Yeah, fine.
Thank you so much for having us here. We're going to ask you a couple of questions. Could you please first introduce yourself and your years of experience?
Yeah, sure. I'm Dr. Anil Kumar Rustagi. I'm Senior Director and Head of Department of CTVS at ShardaCare, Healthcity. It's been more than 25 years that I've been practicing my specialty.
Wow.
Initially, I was associated with Ascot Heart Institute and have worked in prestigious hospitals like Fortis Group, Metro Heart Institute. I was the director and head established Yatharth Group of Hospitals. And now I'm here at Sharda Healthcity, establishing this department here. Well, I've done more than 5,000 to 10,000 surgeries across all of cardiac diseases.
Wow.
Right? And my specialty arises from basically coronary artery diseases, multivalvular heart diseases, minimally invasive cardiac surgery.
All right.
Right? Also, whole spectrum of vascular diseases like aorto-occlusive diseases, peripheral vascular diseases, peripheral aneurysm, doing endovascular treatments for aneurysm and occlusive vascular diseases. And definitely laser vascular surgeries and all that.
Good. And what are the different cases, like the most complicated cases that you had to deal with during those 25 years of experience?
See, I think we get a lot of patients, and especially from the African countries with coronary artery diseases, which have poor heart functions, right? Like their pumping power of the heart is around 25-30%.
Wow.
I, about a month back, operated a South African patient who had a left main disease with 30% heart function. We had to do the surgery within 2 days of his landing, and we did a triple bypass on him, and he's perfectly fine now.
In open heart surgery?
Yeah, in open heart surgery.
Nice.
Right? And post-surgery, we did his echo on the 5th day, and the echo improved to 45 to 50 heart function.
Wow.
Now he's back to his country doing his work and very well.
Has he recovered completely?
Yeah, he's recovered. He's doing his business in South Africa.
Oh, this is wonderful.
Well.
This is wonderful.
Then I operated a very sick teacher from Nigeria. She had a hole in her heart. She had a valve disease, and her tricuspid valve also was severely leaking because of high pulmonary artery pressure. So she was a very sick case. Her oxygen saturation was hardly 93-94%. We had to assess operability, stabilize her, and then we operated her. It took a little bit time, around 1 week to 10 days for her to recover. But now she's back to Nigeria and teaching.
And completely back to normal.
Back to normal.
That's wonderful. That's a wonderful thing.
She's teaching there. So these are two very important. And recently I did a Zambian kid who had a hole in the heart. A kid, 20-year-old, and he was a football aspirant, and there was a hole in the heart, as well as his right side of the valve was leaking very severely, and his lung pressure was more than 100. So we also stabilized him, evaluated him, we repaired the hole, repaired the valve, and now it's fine.
All right, and now this can be very important for the people that are watching right now. What could be the possible causes of all this problem, and what do you think should be the prevention method? How they can prevent this from happening in here?
See, as we know, the African countries, problem of obesity is there.
Obesity.
Right, and this is secondary to increased fatty intake, our dietary habits, sedentary lifestyle, right? All these things, affect the heart.
In long term.
In a long term, right? Because the lipid get deranged, the cholesterol get deposited in your vessels of the heart, leading to heart attacks and blockages and angina, right?
Good.
So all these things need to be careful. You need to be careful about your diet. You need to be careful about your lifestyle activities. Avoid smoking, drinking. These are major two important factors.
Wow.
Right? And any sort of bad diet, whether it is increase in red meat and all those things,
high in cholesterol,
very high in cholesterol.
All right.
So these needs to be avoided by if you have any symptoms of chest pain or if you have breathlessness. Obviously, I would advise whatever medical help you have in your country, take it fast, go to the doctor, consult, and yes, wherever the medical treatment is available, you should run for it.
So now this is a very important question, because this is the point where people need to make up their mind whether they have to go and visit the doctor or they can just readjust themselves with the lifestyle change. What are exactly the red flag? When exactly do you believe that people should consider visiting the doctor as soon as possible?
Okay. Now, first and foremost, yes, any patient who is known diabetic, who is a smoker, who has got a family history of heart disease, mother and father having, heart disease, and has symptoms of a central chest pain. Central chest pain means sometimes people say I have a pain on the left side or on the right side. The pain normally of the heart will be like behind the center of your chest.
Okay.
Right?
Center
of your chest. What we call a retrosternal chest pain. It might radiate to your jaw, it might radiate to your left arm. Right? So whenever you have those symptoms while you're walking, while you're climbing stairs, you should definitely think that it can be of heart origin. That's one thing.
Okay.
The second important thing is if you are having breathlessness. Suppose you are able to do an activity regularly for about 1 or 2 years. Now suddenly you are having a difficulty in doing that activity. Like if you are climbing 1 or 2 flights of stairs and you are not able to do that, there is a breathlessness. Okay. So then you should consider, something has gone wrong. I should consult a doctor. Right? Okay. Third, if you're feeling dizzy or you are having episodes of unconsciousness, definitely you should consider visiting a doctor for your heart as well as your brain, both the things. Because most patients who have got blockage in your heart might also have blockages
in the brain,
in the arteries going to the brain also.
Got it.
Right?
So they're all related.
All related.
Got
right?
It.
So these three are, very
major
cardinal symptoms where you should definitely consult a doctor. And one of the most important thing is, suppose the patient feels acidity all the time, right? Most of it is say because I have eaten a bad meal or maybe I've eaten too much of non-veg and all that. But if on taking antacids or on a chronic antacid the patient is for a long period of time and your stomach pain or acidity pain doesn't relieve, it might be related to heart. So do have an ECG and get your heart evaluated also.
Wonderful.
So these are 4 common symptoms where people should not neglect, should consult a physician at least will have some diagnosis.
Good, very good. Thank you so much. This has been very informative, and we hope to see you again. Thank you so much for your time.
Thank you.
Thank you so much, doctor.